hip precautions are positions you should avoid after surgery in order to prevent complications.
We have a little drawing by the bedside that they're called hip precautions. So we advise the patients not to put their leg in an at-risk position. We don't want them stooping too low or sitting too low in the early postoperative period.
A day or two after hip replacement surgery, you will be asked to sit on the edge of the bed.
The objective is to have that patient get from that horizontal position to the vertical position, sitting up over the side of the bed. And we're observing what they call hip precautions. What we try to do is make sure that person doesn't cross their legs over, so having their leg cross across their body. We also will not have them increase the bending of their hip greater than 90 degrees or the angle of a chair. We also avoid having them turn their knee inwards, which will make their hip come out, or make their foot go outwards, and that's more what they call a dislocating kind of a position.
You should also avoid reaching down to pull up blankets while in bed, and you should not lean forward while sitting, or as you sit down.
We don't have them lean forward and push with the walker here. You have that sort of out of the way, and you push up, put your leg out in that fashion here, then go to the walker.
Dr. Rankin and I had obviously extensive conversation about things to do before surgery and immediately afterwards.
Dr. Thomas Calhoun talks about how important it was to observe these precautions after his hip replacement surgery.
Paid attention to the things that he's recommended, that is to go slow, don't rush the healing process, because at our age it takes a bit longer. And so we were careful about bending, picking up objects off the floor, about crossing our legs, careful about sudden brisk movements.
Precautions can vary depending on the type of hip replacement that was done.
When you have a hip replacement, you can either have an anterior lateral approach down the side, you can have a posterior approach, which is not done as much anymore, or you can have a pure anterior approach, which is not the new procedure, it's kind of an older procedure, but it's coming back in fashion. And the limitations immediately postoperatively are guided by the type of the procedure that's being done.
Taking the proper precautions helped Dr. Calhoun make a full recovery.
Dr. Calhoun has done amazingly well. I think he really was well prepared. He understood what to expect. He'd read up on the procedures, and we discussed it before the surgery. So he's done very well. He went from the acute care side after 3 days to the rehab side. I believe he was there about 5 days. He's been home. He came back much sooner to work than I had anticipated or even recommended. He was back at work for about 3 weeks.
I think that part of the recovery went so well was because I was motivated that once this was over and done, I'd be back to my usual activities. So, again, lots of prayers, specifically my rosary, which I kept with me on a regular basis, and going along with the exercises and the programs that was recommended by Dr. Rankin, my orthopedic surgeon, and also the physical therapist.